least based on some of the evidence that's coming out not only from our lab and with these animal models, but also then human data, is it actually looks like it's very effective. One of the things that we talk about is whether or not to use it as an adjunctive therapy. So you use the triptan and then you follow that up with it, because if they really truly are working through different pathways, it might be good to do a combination therapy like that. We've done that with the triptan with like an NSAID, and then it actually seems to work better for some patients. And that might be the other thing that too we're kind of optimistic is that maybe with the vagus nerve stimulation is that you might be able to lower the dose of potentially a triptan or some other anti-migraine medication, so that you don't get into the medication overuse headaches. So we think that might be something that's really valuable. I think, because it actually works probably more through an endogenous pathway that we already utilize. So what we think happens in chronic migraine especially is that the descending pathway becomes maladaptive. So in other words, you're not filtering out as much of the information that's coming in, so you're changing the threshold at which inflammatory stimuli and other types of stimuli can come in and activate the system. What we think vagus nerve stimulation is doing is it's dampening all that, and it's probably restoring homeostasis, for these individuals. So we think it has potential not only in the migraine field, but potentially even in other oral facial pain conditions. It's like temporomandibular joint pain, which is comorbid with migraine, potentially even trigeminal neuralgias. It might be useful in those, because again, based on our evidence that it's modifying the descending pathway, it potentially could have implications for pretty much a lot, blocking a lot of different pain conditions.